Let's find out a little bit more from Dr. Tony O'Sullivan, who's co-chair of Keep Our NHS Public and retired NHS consultant paediatrician. Doctor, very good evening to you. Thank you very much indeed for joining us here on Talk. It would appear as if we keep spending all the money and extra money that we put into the NHS on the wrong things, or am I just being foolish?
Hi, James. Good to talk to you. I'm sorry, but I overheard the last part of your last clip where you're thinking the NHS is a basket case, and of course I've given my working life to the NHS, so I would start off by disagreeing with you there. It's in real trouble, and from a patient's point of view, they're really worried that they can't see a GP as easily as they wish to. They're worried about waiting lists. They're worried about waiting for an ambulance too long and waiting to get out of the ambulance too long and waiting to get into a hospital bed too long. They're worried about social care being in a state. But I know, looking at you, that your memory should go back to 2010 and the period of time when around the world the NHS was regarded as the best performing major health service in a major economy in the world. And at that point, it was beginning to approach the level of funding, for example, that Sweden, France, and Germany was receiving.
But this feeds straight.
Yes, but a real hemorrhaging of the funding that is needed for it. And of course,
but hang on a second. But this feeds straight into the narrative that here we are, and we will be talking, and we have been talking about why is reform so popular or otherwise, is that we never changed the NHS from a system that was designed 70 years ago. You talk about 2010, and I totally understand that the Labour government had made significant improvements. They had put in these 30-year PFI deals that at the time of higher interest rates might have seemed sensible, but have been costing us since quite significantly, and we're just kicking the can down the road in terms of our funding. We've got 8 million extra people who have arrived in the country in the last 15 or 20 years, and we haven't catered for it. So inevitably, the NHS, when I say it's a basket case, I don't mean it can't be fixed. And I don't mean that the people at the front line can't be, shouldn't be thanked for the incredible work that they do. But what I would say is that from what I've spoken to, consultants or otherwise, they seem to think that money that is being put into the NHS is not being put into the right things, that we are paying an awful lot of people to do jobs that they shouldn't be doing, and that speaking to a doctor last week, as I did, or actually a surgeon who's a very well regarded surgeon, he just said, I just can't get the people to do the stuff that I need, so I am not as efficient as I can and I should be, and it's incredibly frustrating. So, I mean, there are all these things which are going on, and you need the political leadership and the will to get it done, don't you?
Yeah, I agree on lots of points that you're making, and PFI was a disastrous decision. The government should have used public money to own the hospitals that it was building, and instead it's been in hock to private companies for 30 years and sometimes 60 years. But what we need now is, and can I just say that...
But the point is, the reason they did that is they didn't have the money.
It hasn't changed since 1948, and I worked for the NHS for 40 years, and we were constantly changing, so I really take you up on that. That's just absolutely wrong. The NHS is constantly in motion, and the dedication and the skills of NHS staff make sure that the latest technology, the latest research is brought into practice. However, you cannot make major change to a system if it's almost permanently in crisis for the last 14 years by 100,000 staff vacancies, hospital wall ceilings crumbling, GP practices.
But where are we going to get the money from?
Well, I agree that you need to think about how you're spending money. I think, can I just hear me out on this? I've got 4 major points that would start to make sense. The first one is that the government should unequivocally back the NHS as the right fundamental model, the way it's funded, that it should recognise that the major problems that the NHS has been facing over the last few years has been the under-resourcing of the NHS, not enough staff, not enough hospital beds, not enough GPs, that it will start to use every single pound of public money on providing publicly provided services and not spending money giving to private companies to.
But why shouldn't? But hang on a second. But this is at the altar of the NHS, which is like nobody can. Hang on a second. But this is like nobody can possibly criticise this great institution, and it's treated like some kind of almost religion that you can't be rude about it. Ultimately, you have to accept that whether you're an NHS provider or otherwise, this is taxpayers' money, and there is so much of healthcare which is done in the private sector, particularly when it comes to drug advancement or otherwise. And if you're going to pretend that the private sector shouldn't be used, I don't want to see money lining people's pockets unnecessarily. But on the other hand, I don't want to see this. NHS managers' salaries soared by £1.1 billion despite repeated failures to hit targets. You've got people who are applying old working practices that would never be allowed in the private sector. You've got overrun of jobs which are duplicated across the country because of the way that the NHS is set up. It's old-fashioned, it's inefficient, it's wasteful with our money and our resource, and indeed you've got people using the NHS inefficiently because they don't treat it or respect it, because it is not treated like a private company who would have short shrift for people who don't turn up for appointments or adopt different kind of working practices. It's old-fashioned, it needs reform, and until it is reformed, we the taxpayer are having to cough up more money.
It needs a lot of support. It needs the staff that are giving their lives to it to be respected. It needs to retain the excellent staff that it has and stop losing really experienced staff of 20, 30 years experience because they're burnt out and they've not got enough support coming through the system. The reforms that are needed to clinical care are within the capability of the staff that are there. Of course, the private sector has always existed. It was a minimal player up till 2010. If people chose to spend their own money going privately, that was it. But what they're doing now, and it's a wasteful spend of public money, James, you know, it isn't good use of public money. They're spending billions of pounds of money going to, for example, private companies doing cataract surgery on the simplest of cataract surgeries, taking money out of the NHS and undermining NHS ophthalmology departments so that people who are on waiting lists for treatment for glaucoma and macular degeneration are actually going blind on waiting lists. And there's a misuse of public money by spending it in the private sector when the private sector can exist and people that can afford it can go there. I've got no objection to that. And of course, people being referred by the NHS to the private sector at the moment, I would support them in any way if they need to get out of pain or need to have their treatment.
But do you think though that we need to
wrong use of public money?
Sure. Do you think though that we need to change the way that people access the NHS in the sense that you can be anybody, you don't have to prove who you are, you don't have to demonstrate that you're a taxpayer or anything else, that there are too many people, there is health tourism, there are various things, these are precious resources, and also we have to stop people using A&E as a doctor's surgery because we need to be able to have more, presumably, general practice doctors and systems available. I mean, it's just, we're kind of wasteful with our resources. And I don't hear any politician say, can we just, use our resources, our precious resources, a little bit more effectively, please?
Oh, definitely use resources effectively. But one of the most efficient aspects of the NHS is the one that you've just, in a way, rubbished, the access to the GP. One of the cornerstones of the NHS is that everybody who is
resident... It is, but we don't have enough of them.
No, well, that is my point, that one of the exceptional impacts of under-resourcing the NHS and failure to have a workforce plan is that there are thousands too few GPs and patients who get to the NHS, who get to see their GP or get to the hospital, do get very good care, but we have to stop the waits that are destroying our health.
We definitely, either way, we have to stop the waits. Now, I'm almost out of time, but I need to ask you one question that you might think is unfair, but Dr. Tony O'Sullivan, do you think that Wes Streeting is the right man and has the right plan to fix the NHS?
Well, I would go along with Tony Benn and not start attacking personalities. What I think is wrong is that they haven't got the commitment to the right policies. They should back the NHS as a proven and tested model. I don't think the NHS is a religion. It's an evidence-based success when it has been supported properly to succeed and not underfunded to fail and to drive into the hands of the private sector.